Different doctors think of high risk as being different, right? In the derm community, we think of people as being high risk if they have a lot of physical features that look that predispose to melanoma. Things like red hair, blue eyes, very fair skin, a lot of freckles, a lot of moles, a lot of funny-looking moles, a history of having a melanoma before. If you're thinking about a surgical oncologist, they think about high risk as being somebody that has had a positive sentinel lymph node, right? Because they're at high risk for recurrence. And that's more similar to what the medical oncologists think too. So high risk is any of those really. Anybody who's had any element of melanoma or who have those physical constitutional features that put them at risk are all at risk, high risk patients. Now, the one other thing that's really high risk are people who have a strong family history of melanoma, and that's where the genetics overlap into the environment, right? Because if you happen to be one of those really, really rare individuals that inherit a mutation in a high penetrance susceptibility gene like CDKN2A, then your chances of getting a melanoma in your lifetime are around 75% if you live a full, long life, right? So that is a really high risk, but that's a genetically high risk, as opposed to people who have a lot of environmental exposure who are also at high risk, but for different superimposed reasons.